Theory and Practice of Hydrotherapy, Part 11. Just a reminder, as you navigate any health challenge, it's always recommended that you partner with a medical practitioner that shares your philosophy of care of the human body, in health and in disease. Remember that these are just tools to increase the number of tools in your toolbox for maintaining good health and returning to wellness if sick. Any advice that has been given to you from anywhere should be verified and investigated and completely understood before blindly accepting it. Don't blindly accept it, and check it out for yourself and do your own due diligence. Thomas Edison said back in 1903 that the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. And before that, in 1885, in Testimonies for the Church, Ellen White stated that there are many ways of practicing the healing art, but there is only one way that heaven approves. God's remedies are the simple agencies of nature that will not tax or debilitate the system through their powerful properties. Pure air and water, cleanliness, a proper diet, purity of life, and a firm trust in God are remedies for which the want of thousands are dying. Yet these remedies are going out of date because their skillful use requires work that the people do not appreciate. Fresh air, exercise, pure water, and clean, sweet premises are within the reach of all, with but little expense, but drugs are expensive, both in the outlay of means and the effect produced upon the system. Very forward-thinking comments. Of course, anything that God says is current, present, and forward-thinking. 3 John 1 verse 2 says, Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. So if our soul isn't prospering, then the rest of us isn't going to prosper either. So we really need to take care of our soul first and then follow up with the rest of the things. In Romans 12:1 and 2, we're reminded that our bodies are the temple of the Holy Spirit and that we should present ourselves as living sacrifices, holy and acceptable. It's our reasonable service, and not to be conformed to the world and its philosophies, thoughts, and practices, but transformed by the renewing of your mind, that you may prove what is good and acceptable and perfect will of God. So our bodies as a living sacrifice is the perfect will of God. The Ministry of Healing, a great little book, is noted as saying that it's very important that with our body being the temple of God, revealing His glory, and that should be our highest incentive to care for us, our own bodies, and develop our physical powers, strength, and health. We're fearfully and wonderfully made, as the psalmist has said, and he bids us to make it our study and understand its needs and act our part in preserving it from harm and defilement. So we're continuing to look at the roles that pure water can play in its many forms, and we're looking at localized cold, continuation of that, today in our practice and theory of hydrotherapy. And today we'll start with the ice bag or cap. This is a very commonly available device. It can be made out of fabric or a gum rubber, and it's very flexible. Unscrew the cap and come in different sizes. Put the ice in, crushed ice or cube ice. Crushed ice is going to conform better to the place of treatment and have a higher surface area even inside the bag for having cold being applied to that area. So some functions and benefits can help to reduce and prevent swelling if you've had an impact area. Pain relief helps to stop bleeding through the process of vasoconstriction. So any cold is going to vasoconstrict, any warm is going to vasodilate. And part of the practice we've seen in previous presentations is the alternation of hot and cold. So you turn off the blood, turn on the blood, and increase the circulation to an area. So it can reduce congestion and inflammation in a particular spot. So there also can be some reflex benefits associated with cold. So if you can't actually physically apply the cold to a specific spot, you can use the reflex charts to provide relief of congestion, inflammation of deep-lying internal organs. So the bottom of the foot, for example, can affect the appendix as well as the fallopian tube if it's inflamed in a woman. And it can slow and strengthen the heart effects when rapid or weak heart is noted, in addition, using reflex effects. So the appendicitis is interesting, localized cold. Remember reading a story by a gentleman who I met in his 90s, Andy Holland. He wrote a book called Switchbacks, which basically accounts his life as a fire lookout in the North Cascade Mountains of Washington State. He had taken a horse train pack trip up with all the supplies for the summer, and there was no physical link to the space except for this long pack horse trip up, but there was a telegraph wire or a phone wire down to the ranger station. It was a multi-hour trek in for the season. After the pack train had left, and there was no communication with the pack train as it was heading down the hill, he discovered that he had a very painful abdominal pain that turned out with further consultation with the physicians down in town that he had appendicitis. And their advice to him being that he would not survive a trip down, nor would he probably survive another trek up to get him out before the appendix burst, was to put localized cold from the ice pack in the fields that were still there, the ice fields that were still present at the lookout, which he did. And he applied that as long as he could through the summer. It eventually melted away, but during that time, the inflammation was reduced, minimized, and eliminated, and his appendix was removed. No longer hurting, but removed as a safety precaution once he came out of the wilderness after his period of serving as a lookout through the summer. So just an example of the power of cold to reduce inflammation. So applying the ice cap, fill it with crushed ice. Again, that's going to increase the surface area and the ability of it to conform to the area that you're working with. Push down to release the air before affixing the cap, and make sure it doesn't have any seepage around it. So the person here is not using an ice cap, but using an ice bag. They're using some cubed ice in there, which they should be using crushed ice so it conforms better and it's less bumpy. You want to cover the area with a hand towel or cloth. You don't want to apply it directly to the skin. You want to shield the skin from the ice bag because you want to prevent frostbite. So if you leave it on too long or aren't careful, you could freeze the skin. So as the ice melts, replace it with fresh as long as needed. So lightweight bags are best. You might want to suspend or cradle if it's a heavy ice bag to reduce the weight and reduce the pressure. So air in the bag melts the ice faster, so you want to make sure that there's as little air inside the bag as possible. The next is known as the proximal compress, and this is using ice again or cold. So any type of cold compress over a large artery. It helps to slow the blood to the area that's served. So the compress is proximal but affecting a distal area. It can be used on an open wound where a wet compress wouldn't be advised. So you can see the diagram here, remembering that proximal is closer to the body, distal is further away. So the hand would be distal, the shoulder, upper arm would be proximal, the upper thigh would be proximal, the foot would be distal. The head is distal to the neck is proximal to the torso. So it's all in relation to the torso. So choose an appropriate compress. You want to wring out a wet cloth 60 to 70 degrees and or use an ice bag in those areas. So there's major arteries, femoral artery in the groin. You have arteries under the armpits, and in the arms, the axial arteries there, and the carotid arteries in the neck service the head. So you want to frequently change them to keep the cold in effect. As the ice melts, just keep reapplying the cold to maintain its benefit. So locations, the proximal area is the knee and calf, affects the lower foot, so you don't even have to apply it to that distal area to have an effect by reducing the blood supply. Femoral artery affects the whole thigh, elbow affects the hand, groin, affects the whole leg, the upper arm. So you can segment things out a little bit and affect specific areas if desired. Upper arm, forearm, armpit, entire arm. An ice collar affects the head and brain regions and helps especially in inflammation, congestion, and meningitis issues. And again, the carotid arteries will also, in that ice collar, affect the brain. So in this picture here, what arm or what part of the arm is being affected? What is missing in this picture? So the part that's being affected, it's on the elbow, so specifically the hand is going to be applied, having the application to it. So it's being applied to the elbow, but it's affecting the hand distally. If you had it higher under the armpit, it would be affecting the elbow and the hand. And what's missing from this picture? Well, it's the cloth that is not in between the ice pack and the arm, so there's a potential for frostbite here if it's left long enough. In this individual, they're holding it, so the holding it is going to be cold too, and they'll be able to feel that, and they'll probably pull it away in time. But using it on someone else or using it on yourself, you want to use a cloth in between. So next we'll be looking at cold to heating applications of hydrotherapy. So you're using cold to initiate a heating reaction in the body. So you want to have cold applied to an area with a flannel cloth in between, and the reaction that you're seeing is warming, which heats the pack. And the pack is essentially the way your body is wrapped, or the body parts are wrapped. And it functions in increasing circulation. So it begins with a vasoconstriction of the area with the cold, but then as it warms, it vasodilates and increases circulation. So it improves the healing of that area by moving blood to and from it. It moves oxygen and nutrients to it, and waste and toxins away, and just accelerates that, reduces inflammation, helps the debriding process if it's a wounded area, bruised or whatnot. So the first example of a cold to heating application is the dry throat compress and heating throat compress. So there's two different ways to do that. So the cold is covered and results in the warming, and the end effect is that of applying moist heat until your compress actually dries out. We'll look at this a little bit further here. So the benefit is that it reduces inflammation and promotes healing, so great for sore throats, tonsillitis, any laryngitis, any sort of throat issue. And it can be used for several hours. Works perfectly overnight. So the cold wet cloth is placed around the throat and then covered with flannel and an insulating cloth, and it's pinned in place. What I like to do is use like a wool sock and a bandana, wet the bandana, put that bandana around your throat, and wrap it around. Usually wraps about twice if you have a kind of a medium neck. Then put a wool sock around it, and then I hold that in place with another bandana that's just wrapped around once and tied in front, so you can easily undo it. And that works great for me. Safety pins can be a little bit difficult to do sometimes, and I find the tie just simpler. So the flannel reduces air movement and increases the heat to the area by insulating the area, or a wool sock. So useful for sore throat. It's dry by morning time due to the heating effect that your throat creates, increases the circulation, and usually ends up in a better feeling throat. So sore throat, tonsillitis, pharyngitis. So the pharynx is the upper regions of the mouth. Laryngitis, that's down around the voice box. Quinsy, or white spots at the back of the neck, kind of pustules, infection essentially. And inflammation of the ear can be benefited by that heating throat pack as well. So applying it 2 to 3 thicknesses of cloth. So again, that's a bandana that could be used and folded over and wrapped around. About 2 times. You can use strips of cloth or that bandana again. A double thickness of flannel, number 2. An old sock can work nicely, 4 inches wide to cover the strips completely. Secure it in place. You can use therapy tape, safety pins, or tie a dry bandana around it to secure it. So any of those different methods can be utilized. Use cold, dry cloths versus wet on frail persons. So people who may not have the energy to actually warm that up in the warming compress, you can just use a cold, dry cloth called a dry compress. So if compressing the eustachian tubes, it may require wrapping it over the head to keep it in place. So remove it in the morning and quench with cold, so a cold water rinse, and rinse the neck or other area that it may be applied to. And that closes the pores and stimulates a surge of circulation in the area. So heating joint compress, so this is essentially the same thing. You can do the moist compress or a dry compress, but instead of doing it on the neck, you're doing it on the elbow, ankle, wrist, knee, and you're just using the same general procedure, a wet cloth covered by a insulating cloth like flannel, and then secured in place. So it's used in rheumatism or in rheumatic fever. It can also be useful for other painful joints, other types of joint inflammation, which is essentially known as arthritis. So a cold applied to the area with flannel cloth in between, so that can be a wet cloth. Reaction is warming, so it heats the pack and essentially dries it out as it increases circulation. So initially, as a vasoconstriction, and then it vasodilates and brings more blood to the surface into the area around the joint. and improves again by moving waste products and nutrients and oxygen to and from the site of injury. So applying it, strips of wet cloth again, and in a weak or frail person, you might use a dry compress using cool cloths. You could put them in the fridge or freezer to have them initially cool, but not have them wet. Otherwise, it may drain significant energy from them in the process of attempting to warm that. So you can add essential oils to it: wintergreen, camphorated oil, mustard water. So mustard water actually is a very great anti-inflammatory, even mustard paste, and menthol to cotton or the thing that you're adding to the compress can aid in the relief of the pain by counteracting the irritation and also increasing the circulation. If you want an additional warming effect, a little cayenne pepper could also do that too, and that can have a significant warming effect. So use 2 thicknesses of wet moist cloth and hold it in place with gauze or an ace bandage. And you can see the ace bandage methodology of wrapping here in this figure that has been shown here. So once again, if you'd like to review this information and review past and look for present, future rather, presentations that will continue in this series, go to preparingforthetimeoftrouble.com.